Welcome back to our channel where surgery meets the future. Today, we're unlocking the hidden tools that power surgical AI. Imagine trying to learn surgery by watching a 1,000-hour movie without subtitles. Overwhelming, right? Well, what if I told you we could break that movie into clear chapters, label each action, and then teach a machine to recognize what's happening in real time? Today, we dive into 3 magic tools: FFmpeg, CVAT, and YOLO V8, the backstage crew transforming surgical videos into smart, searchable, and teachable moments.
FFmpeg, CVAT, and YOLO V8 form an interconnected workflow that significantly advances medical AI. Let's start with FFmpeg.
What does FFmpeg do in this context?
FFmpeg is crucial for data preparation. It handles large surgical video files by extracting frames, converting formats, resizing, compressing, and clipping them to create manageable, processable segments or frames. For example, FFmpeg efficiently extracts individual frames at a specified rate from hours-long surgical videos.
How does CVAT fit into this workflow?
CVAT is used for detailed annotation of surgical events. Human annotators label elements within surgical videos and images, creating ground truth data, essential for training AI models. They use CVAT to identify and mark surgical instruments, anatomical structures, surgical steps, and any pathologies or anomalies observed during procedures.
Can you give specific examples of what annotators do with CVAT?
Definitely. Annotators draw bounding boxes or polygons around surgical tools, mark anatomical structures, label different phases of surgeries, and annotate any abnormalities like polyps or tumors. CVAT's web-based nature allows for collaborative projects supporting various annotation types needed for surgical analysis.
And what about YOLO V8? How does it utilize the annotated data?
YOLO V8 is trained on the meticulously annotated surgical data to perform real-time object detection and analysis. It's incredibly fast and accurate, making it ideal for applications in the operating room, such as tracking surgical tools, monitoring procedures, detecting anomalies, and enhancing robotic surgery.
Can you elaborate on the real-time applications of YOLO V8?
Sure. YOLO V8 can automatically detect and track surgical instruments, provide real-time feedback during surgeries, highlight suspicious areas requiring immediate attention, and guide robotic instruments with precision. It also aids in training and education by providing feedback during simulations or live surgeries.
How do these tools work together?
The synergy is clear. FFmpeg prepares the video data, CVAT enables detailed annotation, and YOLO V8 leverages this annotated data for accurate, real-time analysis. This combination empowers researchers and medical professionals to develop AI solutions that improve patient outcomes and revolutionize surgical practices.
That's fascinating. Thank you for explaining how FFmpeg, CVAT, and YOLO V8 contribute to surgical data analysis.
You're welcome. I'm glad I could help clarify their roles and importance in advancing medical AI.